Hi there, this is Michelle, a speech therapist from Therapy Works Together, and today I wanted to talk to you about childhood or toddler stuttering or disfluency. I get a lot of parents coming to me and asking to me, is this normal? So I'm going to be talking about kids who are approximately the age of 2 to 5 years old, at which time about 5% of them, 5% of them, might present with a stutter or a disfluency. Now, what are we listening for when we're listening for a stutter or a disfluency? Three things. One is repetitions, so repeating a sound or a whole word. Another one is prolongations, so extending a sound, stretching it out or making it longer. And the other one is interjections, and that's basically when you use some sort of filler word like or or things like that. So again, when a child is about 2 or 3 to 5 years old, there's like a massive language burst, growth, explosion. They're learning, they're acquiring new words all the time. Their sentences are getting longer. The grammatical complexity is getting longer, and their mouth, the motor movements in their mouth sometimes can't keep up. And what their brain is producing and the complex thoughts that they're producing sometimes just doesn't get translated in a fluent way as it comes out of their mouth. So sometimes you might hear your child, your toddler, or your preschooler saying, I went to the playground today and I saw my friend. Things like that. They'll stretch it out. They'll repeat words. They'll kind of look around, they'll hunt around for a word, but you'll hear those disfluencies increasing. And what I wanted to tell you right now is that some of the time it's actually normal, right? So again, like I was saying, there's this huge language growth and their mouth can't keep up. So you might end up coming to that intersection, and that intersection is disfluency, or what some parents might think of as stuttering. So how do we know if something is a stutter that we should kind of let it flow and let it happen, and it has to do with language growth, or it's something that you need to see a speech therapist for? So first of all, it's really important to note that it's never a bad idea to get a professional's opinion. If you pick up the phone and call us and say, this is what I'm hearing, oftentimes a speech therapist will be able to talk to you about what is something you want to follow up on, or pay attention to over the next few months, or what's something you can just sort of ignore and it might resolve itself on its own. So things that we're looking for are tension, right? Is a child afraid to talk? Is it lasting longer and longer? Is it associated with something maybe traumatic that happened, right? Sometimes a last client recently that I've had a trauma that had to do with breathing, right? And that's when a disfluency started. So is it getting worse, right? Is there a history of disfluency or stuttering in the family? Did it start after age 3.5, approximately? Is it lasting 6 or more months? These are things we want to pay attention to. Is your child avoiding certain words, right? Do they know that they're going to be disfluent on, a word that starts with a certain sound, like T sound or a D sound, right? And they're avoiding those. Is there tension, like I said, not only, tension emotionally, but tension in their body, right? Sometimes a child will, or even an adult will develop tics, right? Or some sort of physical tension that you can actually see. That's something we want to pay attention to. So whether or not a disfluency is something that is turning into a true stutter, or a disfluency is something that's more developmental and something that has to do with that language explosion, the recommendations that a speech therapist might make are, at least at the base, or at the first level, very similar, and those are to create a fluency facilitating environment. So what is included? What are some of the things that we use to create a fluency facilitating environment? The first is try not to interrupt, okay? Have some patient waiting time when you're speaking to your child. I'm going to have these little pauses here to model it for you. That's another thing we want to do, is really model for our children the slow, steady speech where we actually have time to process our thoughts and what we want to say, right? So a child will come home from school all excited, and wanting to tell you all about their day and what happened and who they played with. Maybe they're competing with another sibling. Maybe there's a lot of, rush to get dinner on the table or get organized or do homework or whatever it is. There's a lot of tension in our lives these days. So if we can model an opportunity where we sit down and speak slowly and have time to process, your child will also understand that they too have time to slow down. They're not in a hurry, and you're there to listen. And one of the number one things that I tell parents to do that they often think they need to do is do not tell your child to slow down. You do not need to tell them to slow down. You don't need to ask them to do it. You don't need to ask them to be mindful of it. Nothing about slowing down. If there is a rate of speech that is more rapid, or if, like I said, they're sort of excited or hurried or wanting to tell you about their day, the one thing you would do is model slow speech, increased pauses, and sort of waiting, giving them that time to speak. I also recommend to parents to take, especially if you have multiple kids, to take maybe 5 minutes twice a day if you can, to give your child uninterrupted parent and child time where they get to tell you what they think, get their thoughts out, get their ideas out. No questions. You are just there to listen. Thank you for listening. Come back to the channel and listen. There's always more tips that I'm posting, and thank you for listening to this video. Bye.